Good morning. This is Dr. Timothy Scott Beck here at LifePoint Medical, and I want to say good morning to you and let you know that we're open on September the 4th, 2020, and we're seeing patients this morning. My weekend crew is up and running now, and that is Dr. Woody on Friday, Saturday, and Sunday, and Mary Jane, that's her. She works all day Friday also. For continuity purposes, we have people staggered throughout the week and the weekend, so we can do a better job at looking after the patients. But we're open. We want to hear you. We want to get you taken care of. And we've got our telephone, 706-782-0016. Our text is 706-949-1129. Our email is office at drtsbeck.com. And then we got drtsbeck.com, our website where you can request an appointment, either a new or a follow-up on the website. So we're up and going good. It is a Labor Day weekend, so now we will be closed on Monday, okay? And the way I've structured the office now is the only time that we're going to close, or I'm going to try to do this, I don't know, it'll be completely 100%, but on the day of the holiday. So Labor Day is Monday, so we will be closed, but we'll be open Saturday and Sunday. And I believe John will be covering the PA that works with me. He'll be covering the Saturday and the Sunday shifts because of some obligations of Dr. Woody. So you're welcome to call us this weekend, and you'll see a familiar face. That'll be John, and John is in constant contact with me, and he's more than welcome to call me, and he knows it, and we'll get you taken care of. Now, some of the changes I've seen here, I do get some feedback sometimes. Mostly it's positive, sometimes it's negative. I want to explain a couple things. One of the things that, from the way I've been structuring the office, one of the things that I've focused in on is to make sure that I have time to take care of complex patients. Okay, so during the day when I'm seeing patients, I try to see everybody 100%, but I don't always do that. And the reason I don't do it is because sometimes I have to stop and really put a lot of time into somebody's particular problem. And some of you guys have experienced that. I mean, I've spent more time with you than normal. But part of the way that I'm doing this with having John, the PA here, and the nurse practitioner is we get patients seen and we get their needs taken care of. And then it allows me to hone in a little bit on people who are got confusing or particularly serious issues or complications, and I can take and go in the room with the provider, and we can figure out what's going on with you and spend a little bit more time focusing on what's wrong with you, so we can maybe prevent you from going to the hospital or getting sicker or getting you to the right place at the right time. So that's part of my plight here, and it really works good. I love it. I do think it helps the patients out, and the only thing I guess we have to do, we need to communicate with people a little bit better when they have to wait. We do have sometimes people have to wait, and usually if you're waiting, it's because we're stuck in something that we can't just walk away from, and that does happen. Matter of fact, I think it's happened every day this week, where people have got so sick, or we're seeing them in such a state of that we've got to do something. We've got to stop and take care of that patient. I hope none of you ever have to experience that, but I want you to know that we're sitting here and we're waiting for it, and we want to help you, and we're going to do it. And but there's give and take because there's one of me and everything. The only thing is I will tell you is I take responsibility for everything that does happen here in the office, and I do that proudly, and I love what I do. All right, let's talk about the COVID-19. They're reporting 290 cases today. That's up 3 from yesterday. We are doing a wonderful job holding this thing off. And it's been a long time since we've been fighting with it, okay? And we've done really good, okay? The question is, are we going to be able to stop it at all? I don't know, okay? But I do think that the death rate, at least for us in this community, has been minimized, okay? But it's at 6, and that's what it was yesterday. And every death to me is a tragedy or you know, something that I don't want to happen to people. Okay, but I want you to stay safe. It is a holiday weekend, so I want you to continue your social distancing. I don't want a lot of social isolation though, okay? I think, and I still every day see people who are alone, scared, and I think you need to keep your connections with the people in your world, okay? I think it's very important, and I think I do it. I communicate with my mom and my family as much as possible. So don't isolate, but use your hand sanitizer when you're out and use your mask when it is appropriate. Okay. And if you personally are sick, if you've got upper respiratory symptoms, I want you to stay home. Okay. And yesterday I mentioned the vitamin ADK10 that we've got here in the office, and actually somebody sent me an article where they're speculating that actually having adequate levels of vitamin D can help the COVID not be as serious a disease for you if you do contract it. So there is, I do believe, and I've seen 2 or 3 other articles about this where they say having an adequate amount of vitamin D helps with fighting off the COVID or preventing it from being too devastating for you. All right, this is Dr. Timothy Scott Beck. I'm signing off for the weekend, and I've got a crew here waiting for you. And we all want to see you, and I'm helping everybody try to do it the right way or the way that I've always done it. So come on in and give us a call if you need something, okay? Have a wonderful weekend. Thank you.